Hello, my name is Angela Armstrong, and I will be discussing substance abuse and substance abuse treatment in rural areas. I chose substance abuse because it is one of the major issues in today's society. It is also a topic that needs to become a normal discussion among children and adults as a preventative measure. So, without taking too much of your time, let's discuss substance abuse in rural areas. Substance abuse is defined as excessive use of psychotic drugs, such as alcohol, pain medication, or legal drugs. It can lead to physical, social, or emotional harm. Causes of addiction or substance abuse can be genetics, including the impact of one's environment on gene expression, account for about 40 to 60% of a person's risk of addiction. The environment is a factor as well, which may increase a person's risk of addiction, include a chaotic home environment and physical abuse, parents' drug use and attitude towards drugs, peers' influences, community attitudes towards drugs, and poor academic achievement also can lead to addiction/substance abuse. Teenagers and people with mental health disorders are also more at risk for drug use and addiction than other populations. Substance abuse in rural areas. It is noted that 14 specific barriers to substance abuse recovery are identified within 4 broad categories: access to treatment services, access to other professionals, access to peer support groups, and barriers of confidentiality. Although telehealth expansion of mental health care, intensive referrals, and other efforts might enhance the access to care, the evidence suggests that practitioners and researchers should remain aware of community-level barriers to recovery for a substance use disorder and work with clients to overcome them. Category of the barriers: access to treatment, the distance to care, the distance to aftercare, and family involvement. Access to other professionals include availability of professionals, diversity of professionals, and training of professionals. Access to peer support group, distance to meetings, the number of meetings, recovery program diversity, and meeting diversity sponsorship options. And the last barrier is barriers to confidentiality, professional relationships, support group member relationships, and social community relationships. Statistics on treatment facilities in rural areas. It is noted that nationwide, 26% of treatment facilities in the United States offer residential treatment, but 81% offer outpatient treatment, indicating that standard of care is to treat patients while they are integrated in their home setting. Yet, only 14% of outpatient facilities are located in rural counties, suggesting rural residents routinely must seek treatment far from home. Further, most of the outpatient facilities located in rural counties attempt to treat a range of mental health conditions, with only 42% focusing primarily on substance abuse disorder. The distance to continuing care in rural areas. In the review of McKay, 20 years of controlled studies of continuing care found evidence for effectiveness of longer and more active aftercare programs, but also called for alternative delivery methods, noting patients might be unwilling and unable to attend traditional aftercare. He specifically mentioned transportation as a barrier. Research confirms that the distant barrier is particularly acute for rural residents. After treatment discharge, only 40% of patients living more than 25 miles from the nearest aftercare facility complete any aftercare. Those traveling less than 10 miles are 2.6 times more likely to receive continuing care and those traveling 50 miles or more than those traveling 50 miles or more. So some of the system theories or some of the theories that would assist us in addressing this issue would be one would be the system theories. Social workers focuses on the interaction and relationship between and among individual groups, organizations, and communities within their social, economic, political, and geographic environment. Those system theories would include the microsystem, the mesosystem, and the macrosystem. In the macro system, these systems primarily refer to the system that addresses the needs and concerns of individuals and immediate families. In this system, you will see social workers putting their craft to work, one-on-one sessions, developing treatment plans, and working closely with families. In the mesosystem, this system refers to the system of practice that focuses with families, small groups, and organizations at a local level. At the meso level, social workers are charged with bringing people together in small groups to improve communication relationships through mediation. Macro system. This system refers to a system of practice that focuses on creating and sustaining positive changes in the general society. In this system, this social worker engages in political actions, administration, and education supervision, and community and organization. We can also utilize the ecological theory, which encourages social workers to consider social, environmental, and biological precepts that encourage the client. Okay. Substance Abuse and Mental Health Service Administration, also known as SAMHSA, is a publishing guidance today to help broaden healthcare professionals' understanding of medication that can be used to treat Americans with substance abuse disorder. Substance Abuse and Mental Health Service Administration is also committed to improving prevention treatments and recovery support services for mental and substance use disorders. The program that I also chose to utilize as far as a resolution to this issue would be the Evidence-Based Practice Resource Center. It provides communities, clinicians, policymakers, and others with the information and tools to incorporate evidence-based practices within their communities and clinical settings. And as we're wrapping up substance abuse in rural areas, here are some fun facts or did you know facts about addiction. According to the National Survey of Drug Use and Health, 19.7 million American adults ages 12 and older battle substance use disorder since 2017. Almost 74% of adults suffering from substance use disorder in 2017 struggled with an alcohol use disorder. 38% of adults in 2017 battled with illicit drug use disorder. That same year, 1 out of every 8 adults struggled with both alcohol and drug use disorder simultaneously. In 2017, 8.5 million American adults suffered from both mental health disorder and substance abuse disorder or co-occurring disorder. Drug abuse and addiction cost American society more than $740 billion annually in lost workplace productivity, healthcare expenses, and crime-related costs. As we have reached the end of this presentation, I hope that the information was informative and helpful. Again, my name is Angela Armstrong. Thank you for your time and have a great evening.